Hello, everyone. My name is Jana Holzauer, and I'm in Issues and Trends Facing Healthcare at Fort Hays State University. And today I'm going to be talking about non-compliance with psychotropic medications. So let's take a closer look of medication non-compliance in patients with mental illness. This is at an all-time high. Aaron and Wang identifies various studies that estimate the adherence to psychotropic medications among people with mental illness. They break it down according to the different illnesses. Major depressive disorder, 28 to 52%. Bipolar disorder, 20 to 50%. Schizophrenia, 20 to 72%, and generalized anxiety disorder, 57%. Again, these are the numbers of the people that do adhere to the psychotropic medications. As you can see, this leaves a big amount of people that are not adhering to the medications as prescribed. The importance of taking psychotropic medication. It is very important once a person with mental illness finds a psychotropic medication that treats symptoms effectively to adhere to the regimen set forth by the healthcare provider or risk relapse of symptoms or even worse. Velgin, Sajic, Hatch, Kramada, and Daughtry report non-adherence to the treatment of severe mental illness, also abbreviated SMI, increases the risk of relapse and hospitalization and reduces the quality of life. So you might ask yourself, why is this an issue? As a psychiatric mental health nurse, medication noncompliance is a very hot topic. Many patients in the area that I work are frequent flyers who return after they have not been taking their medications. This is a national problem. The National Alliance of Mental Health, or NAMI, in 2018 reported that 1 in 5 adults experienced mental illness and 1 in 25 experienced a severe mental illness. Velgin et al. 2016 reports that medication non-adherence in patients with SMI can lead to hospitalization, increased use of emergency psychiatric services, and that's where I work, violence, arrest, increased risk of suicide attempts, poor social and occupational functioning, and the reduced quality of life. Many people with severe mental illness that I've taken care of have reported that they stopped taking their medications because they felt like they were healed after they were taking their medications for a certain amount of time. They were no longer exhibiting their normal symptoms, so they felt like they were healed and felt like they didn't have to take it anymore. This is also common when people take antibiotics. Once they're healed, once they feel healed, they think that their whole body is healed. So we need to make sure not only are we promoting people to continue taking their antibiotics until the course is done, but also to continue for them to take their psychotropic medications. MentalIllnessPolicy.org reports that the most common reason for patients with severe mental illness not complying with their medication regimen is due to something called anosognosia. Anosognosia is defined as a lack of awareness of their illness. So here are some more reasons why people are not compliant with their psychotropic medications defined by mentalillnesspolicy.org. This could be due to alcohol abuse, drug abuse, the cost of the psychotropic medications, a poor relationship between the psychiatrist and the patient, so maybe the psychiatrist isn't exhibiting therapeutic communication and the patient feels like the psychiatrist is against them. Also, the stigma surrounding mental health, which we'll address more in the next slide, and also intolerable side effects. So here are two comics that I feel really address the mental health stigma. It says, if physical diseases were treated like mental illnesses. I get that you have food poisoning and all, but you have to at least make an effort. And you just need to change your frame of mind, then you'll feel better. And this guy's hand is chopped off. And then there's another comic to the right that says, when we break a bone, sign my cast. When we get a bad cut, check it out, I've got 12 stitches. When we get the flu, we make a Facebook post about it. But when we struggle with mental health issues, we just say, hey, we don't even talk about it. And this really needs to stop because mental illness is a real illness. Here are some ways that I think would help people to adhere to their psychotropic medications. First, for medication and diagnosis education for the patient. Emphasizing when the patient begins to feel better to not stop taking their medications, and also emphasizing mental illness is just as much of an illness as cancer and diabetes. Another strategy is alcohol and drug treatment programs combined with the mental illness treatment. It's very easy to stick in like an Alcoholics Anonymous group in a mental illness treatment center. Also, legislation that ensures that patients with a severe mental illness will have access to their prescribed psychotropic medications. And for more training for mental health professionals to develop a therapeutic relationship with their patients, because this is so important. I have a little quote on the side that says, "You are not your illness. You have a name, a history, a personality. Staying yourself is the battle." As nurses, we can do our part to break the stigma of mental illnesses. Mental illness is an equal opportunity illness. Every one of us is impacted by mental illness. 1 in 5 adults are dealing with the illness, and many are not seeking help because the stigma prevents that. Also, there's another quote on the side that says, "Mental illness is the only disease that can make you deny its own existence." It is up to us to treat mental illness as a true illness and not something the patient can change on their own. Here are my references for anybody who would like to look more into this common issue in the mental health world. And I thank you guys for your time, and I hope everybody has a great holiday season.